name is Sojikul, and today I'll be talking about the anatomy of posterior abdominal wall and the lumbar plexus. Let's first start with the muscle of the posterior abdominal wall. So first is the psoas major. It is originated at the transverse process of the L1 to L5 and body of the T12 to L5 and the intervertebral disc. The insertion is at the middle surface of the lesser trochanter of femur, and its action is to flexus and laterally rotate the hip. And lastly, the innervation is by the anterior primary rami of the L1 and L2. Next is the psoas minor. The origin is at the bodies of T12 and L1 and the intervening intervertebral disc, while the insertion is at the fascia over the psoas major and iliacus. Its action is to weak the flexor of the trunk, and the innervation is by the anterior primary rami of the L1. So third is the quadratus lumborum. The origin is at the epixis of the transverse process of the L1 to L4, the iliolumbar ligament, and the posterior third of the iliac crest. It is inserted at the inferior border of the 12th rib. The action is to fix the 12th rib during respiration and lateral flexus the trunk. The innervation is by the anterior primary rami of T12 to L3. So next is the iliacus. The origin is at the iliac fossa within the abdomen. The insertion is at the lowermost surface of the lesser trochanter of the femur. The action is to flexus medially rotates hip, and the innervation is by a femoral nerve in abdomen L2 and L3.
So first is the quadratus lumborum, next is the psoas minor, then psoas major, and finally the iliacus.
The last one is the diaphragm. The origin is divided into parts. At the vertebral part is the crura from the bodies of 1 and 2 on the left and L1 to L3 on the right. And for the costal part, it's the medial and lateral arcuate ligaments, inner and inner aspects of the lower 6 ribs. For the sternal part, it is from the posterior aspect of the xiphoid. The insertion is at the central tendon, and the action is to inspiration and assist in raising intra-abdominal pressure, while the innervation is by the phrenic nerve for motor, and the sensory is by phrenic, intercostal, and the upper 2 lumbar nerve roots. So the diaphragm is located at the inferior-most aspect of the ribcage, filling the inferior thoracic aperture. It acts as the floor of the thoracic cavity and the roof of the abdominal cavity. The parts of the diaphragm that arises from the vertebra are tendinous and in structure and are known as the right and left crura. So for the right crest, it arises from the L1 to L3 and the intervertebral disc. Some fibers are from the right crest surrounding the esophageal opening, acting as a physiological sphincter to prevent the reflux of the gastric content into the esophagus. So for the left crest, it arises from the L1 to L2 and the intervertebral disc. The muscle fiber of the diaphragm combines to form a central tendon. This tendon ascends to fuse with the inferior surface of the fibrous pericardium. So moving on to the right picture, there are 3 openings that act as a conduit for these structures. For the cavo hiatus at T8, the structure that passes through is the inferior vena cava and the terminal branches of the right phrenic nerve. However, you'll see the esophageal hiatus on the level of T10. The structure that passes through is the esophagus, the right and left vagus nerve, and the esophageal branches of the left gastric artery and vein. Lastly, for the aortic hiatus at the level of T12, the structure that passes through is the aorta, the thoracic duct, and lastly, the ascicus vein. Moving on to the ligaments, the medial arcuate ligaments passes over the aorta and is the landmark of greater and lesser splenic nerve. However, for the median arcuate ligament, it is a thickening fascia of the psoas major and has iliohypogastric nerve and ilioinguinal nerve passes under. Or lastly, the lateral arcuate ligaments is a thickening fascia of the quadratus lumborum, which is also a landmark of the subcostal nerve. Moving on to the second part, the fascia of the posterior abdominal wall. So the layer of fascia lies between the parietal peritoneum and the muscle of the posterior abdominal wall. The fascia is continuous with the transversalis fascia of the anterolateral abdominal wall. The psoas fascia covers the psoas major muscle. It is attached to the lumbar vertebrae medially, continuous with the thoracolumbar fascia laterally, and continuous with the iliac fascia inferiorly. The thoracolumbar fascia consists of the 3 layers, posterior, middle, and anterior. So the muscles that are enclosed between these layers are quadratus lumborum, is between the anterior and middle layers, and the deep back muscles is between the middle and posterior layers. So next is the blood vessels of posterior abdominal wall. The abdominal aorta emerges from the aortic orifice of the diaphragm at the level of T12 vertebrae. It begins its course anterior and to the left of the vertebral column, and it continues towards for about 10 cm. Upon reaching the lower part of the body of the L4 vertebra, it bifurcates into its terminal branches to the left of the medial plane the left and right common iliac arteries. Common iliac arteries then branch further into the external and internal iliac artery. We divided its branch into unpaired visceral, paired visceral, and paired parietal branches. The unpaired visceral branch, the celiac trunk arises on the anterior aspect of the aorta, just inferior to the aortic orifice of the diaphragm at the level of the lower border of the T12 vertebrae. So shortly after its origin, the trunk gives out its three branches: left gastric artery, common hepatic artery, and the splenic artery supplying the foregut. For the superior mesenteric artery, it arises about 1 cm below the celiac trunk at the level of L1 vertebrae. It supplies blood to the midgut. Lastly, for the inferior mesenteric artery, it arises about 4 cm superior to the bifurcation of the abdominal aorta at the level of L3 vertebrae. It supplies blood to the hindgut. Moving on to the paired visceral branch, the suprarenal artery arises on each lateral side of the abdominal aorta near the origin of the superior mesenteric artery, supplying blood to the suprarenal glands. So, next is the renal artery. It branches off the lateral side of the aorta at the right angle immediately below the superior mesenteric artery. It supplies blood to the left and right kidney and gives out the inferior suprarenal artery to supply the suprarenal glands. The gonadal artery arises from the anterior aspect of the aorta, just inferior to the renal arteries. In male, this artery is called the testicular artery and supplies the testes, while the female counterpart is called the ovarian artery, which supplies the ovaries. For the paired parietal branch, first is the inferior phrenic artery, arises from the posterior lateral aspect of the aorta immediately below the aortic hiatus. This artery supplies the inferior surface of the diaphragm and gives out the superior suprarenal artery to supply the suprarenal glands. Next is the lumbar arteries, typically four pairs of arteries that arises on the posterior surface of the aorta. They supply the posterior abdominal wall and the spinal cord. Lastly, the subcostal artery, in part supplying the vertebra and spinal cord. They are considered one of the segmental artery of the aorta too. So another important artery of the posterior abdominal wall is the superior vesical artery. This is a branch of the umbilical artery of the anterior division of the internal iliac artery. It supplies a part of the bladder, ureter, seminal vesicle, and the ductus deferens. The inferior vena cava arises from the confluence of the common iliac vein at the level of L5 vertebrae. It then ascends the posterior abdominal wall to the right side of the aorta and the bodies of the L3 to L5 vertebrae. The tributaries of the IVC or the inferior vena cava correspond to the branches of the abdominal aorta. So the direct tributaries are the inferior phrenic veins at T8, right suprarenal at L1, renal at L1, right testicular vein or gonadal vein at L2, the lumbar veins at L1 to L5, the common iliac vein at L5, and the hepatic vein on the level of T8, as you can see in the picture on the right. The left gonadal and the left suprarenal veins drain first into the left renal vein. The veins of the stomach, spleen, pancreas, small and large intestine first empty into the hepatic portal vein. The hepatic portal vein then carries this blood to the liver to be processed and detoxified. Then the blood reaches the IVC or the inferior vena cava through the hepatic veins. The inferior vena cava communicates with the superior vena cava through the collateral vessels, which include the azygos vein, lumbar veins, and vertebral venous plexus. Next is the ascending lumbar vein. Starts at the common iliac veins, then runs superiorly, intersecting with the lumbar veins as it crosses them. Then it passes behind the psoas major muscle, but in front of the lumbar vertebrae. When the ascending lumbar vein crosses the subcostal vein, it becomes one of the following: the azygos vein, in the case of the right ascending lumbar vein, and the hemiazygos vein, in case of the left ascending lumbar veins, as you can see in the picture. So the fourth part is the lumbar plexus. The anterior rami of the L1 to L4 spinal root divided into several cords. These cords then combine together to form 6 major peripheral nerves of the lumbar plexus. These nerves then ascend down to the posterior abdominal wall to reach the lower limb, but they innervate their target structures. So first is the subcostal nerve running along the lower border of the 12 ribs, but in front of the quadratus lumborum, perforates the transversus and passes forward between it and the oblique internus. It communicates with the iliohypogastric and the ilioinguinal nerve of the lumbar plexus. The iliohypogastric nerve is the first major branch of the lumbar plexus. It runs into the iliac crest along the quadratus lumborum muscle of the posterior abdominal wall. It then perforates the transversus abdominis and divides into its terminal branch. For the root is L1, with contributions from T12. The major function is to innervate the internal oblique and transversus abdominis. The sensory function is to innervate the posterolateral gluteal skin in the pubic region. For the ilioinguinal nerve, it follows the same anatomical course as the larger iliohypogastric nerve. After innervating the muscle of the anterior abdominal wall, it passes through the superficial inguinal ring to innervate the skin of the genitalia and middle thigh. For the root is L1. The motor function is to innervate the internal oblique and transversus abdominis. For the sensory function, it innervates the skin on the superior anterior medial thigh. In male, it also supplies the skin over the root of the penis and anterior scrotum. In female, it supplies the skin over the mons pubis and labia majora. So after leaving the psoas major muscle, the genital femoral nerve quickly divides into a genital branch and a femoral branch. The root is L1 and L2. For the motor function, the genital branch innervates the cremasteric muscle. However, for the sensory function, the genital branch innervates the skin of the anterior scrotum in male or the skin over the mons pubis and labia majora in female. This nerve is a lateral cutaneous nerve of thigh. It has a purely sensory function. It enters the thigh at the lateral aspect of the inguinal ligament, where it provides a cutaneous innervation to the skin there. The root is L2 and L3. As already said, it has no motor function. However, for the sensory function, it innervates the anterior and lateral thigh down to the level of the knee. So the femoral nerve is one of the major peripheral nerves of the lower limb. The nerve root is L2 to L4. The motor function is to innervate the anterior thigh, a muscle that flexes the hip joint and extends to the knee. For the sensory function, it supplies the cutaneous branch to the anteromedial thigh. For the obturator nerve, it is a major peripheral nerve of the lower limb. The nerve roots are L2 to L4. Its motor function is to innervate the muscle of the medial compartment of the thigh, while the sensory function are to innervate the skin of the medial thigh.
So you see that this is the iliohypogastric nerve, the next is ilioinguinal nerve, and the last arrow is the lateral cutaneous nerve. This is the femoral nerve, and the next two is the femoral branch and the genital branch of the genital femoral nerve you see in the arrow shown in the video. And the last one is the obturator nerve.
So now we're moving on to the last part, the ganglion of the autonomic nervous system of the abdomen. The greater splenic nerve is the highest in position of the three nerves, and it receives branches from T5 to T8 thoracic sympathetic ganglia. The lesser splenic nerve lies below the greater one and receives a branch from T9 and T10 sympathetic ganglia. And the least splenic nerve is the lowest nerve receiving branches from T11 and or T12 ganglia. The lumbar splenic nerve are the splenic nerves that arises from the lumbar part of the sympathetic trunk and travels to an adjacent plexus near the aorta. They originated from L1 and L2. These nerves contain preganglionic sympathetic and general visual afferent fibers. Lastly, the pelvic splenic nerve, also known as nervi origin, are preganglionic or presynaptic parasympathetic nerve fibers that arises from the S2, S3, and S4. The nerve roots of the sacral plexus. These nerves form the parasympathetic portion of the autonomic nervous system in the pelvis. This is the aortico-renal ganglion. The sympathetic system passes via the lesser thoracic splenic nerve, branches to the renal plexus. The motor function is supplying the vascular smooth muscle of the branches of the renal artery, while the sensory function is to receive pain sensation from the kidney, suprarenal gland, and upper ureter. The aortico-renal ganglion is a sympathetic ganglion located above or near the origin of the renal artery from the abdominal aorta. For the celiac ganglion, it's a preganglionic sympathetic axons arrive via the greater thoracic splenic nerve. The branches to postganglionic sympathetic axons distributed via the celiac plexus along the branch of the celiac trunk. The motor function is to supply the vascular smooth muscle of the branches of the celiac trunk, while the sensory function is to receive the pain sensation from the stomach, liver, spleen, upper half of the duodenum, and pancreas. Celiac ganglion are located on the abdominal aorta at the origin of the celiac trunk. Next is the superior mesenteric ganglion. The preganglionic sympathetic axons from the celiac plexus branches to the contributes to the superior mesenteric and intermesenteric plexus. For the motor function, it supplies the vascular smooth muscle of the branch of the superior mesenteric artery, while the sensory function is to receive the pain sensation from the lower half of the pancreas, duodenum, jejunum, ileum, cecum, appendix, ascending colon, and the transverse colon. So next is the inferior mesenteric ganglion. For the motor function, it supplies the smooth muscle of the vessel, supplying the descending colon, sigmoid colon, and the rectum. For the sensory function, it is to receive pain from the descending colon, sigmoid colon, and rectum. Inferior hypogastric ganglion lies between the pelvic viscera and the pelvic wall. The superior hypogastric ganglion. For the postganglionic sympathetic axons, this ganglion has hypogastric intermesenteric plexus and the lumbar splenic nerve synapse. For the branch, it has hypogastric nerve. Its motor function is to supply the vascular smooth muscle of the pelvic viscera, and for the sensory function is to receive pain sensation from the pelvic viscera. Lastly, the inferior hypogastric ganglion. The postganglionic sympathetic axons is synapsed by the hypogastric nerve and sacral splenic nerve. However, for the preganglionic parasympathetic axon, it is synapsed by the pelvic splenic nerve. For the motor function, in case of sympathetic ANS, it supplies the vascular smooth muscle of the vessel supplying the pelvic viscera, while in the case of parasympathetic ANS, it supplies the smooth muscle of the pelvic viscera. For the sensory function, it receives the pain from the pelvic viscera, general visual afferent from the pelvic viscera.